What Loma Linda means to me is really family. It's a place that you want to be. It's a place that if you're falling down, they're going to be there to help pick you up. And to have that second family that really cares about you, knows you, I think is priceless.
I've grown up here. I was a 25-year-old when I started, I'm 56 now. And when things are going rough, you have that best friend at work. You have that person you can turn to. I think people see that, and that's what keeps people here.
When I started, I was a new grad. This was my first job. There was so much to learn, and now, I oversee a team of wonderful people, and it really does make me proud to be a part of Loma Linda University Health.
When I was in active duty in the Norton Air Force Base, which is down the street, San Bernardino, I used to work in the emergency room. We would bring a lot of our patients here to Loma Linda. Ever since then, we just fell in love with it. It was one of the best places we like to bring our patients.
My wife was hired here first. She basically flew out here, started the job. We just had a miscarriage. And through our phone conversations, she's just like, I've never worked any place like this before. Everyone's so nice. It's really a family.
I had the privilege of starting my career here right before the pandemic started. And I remember we had members of our faculty going around with vaccines that we didn't want to expire and literally knocking on doors and saying, we want to make sure that you're protected because you matter, you're important to us.
When I was deployed for Operation Desert Shield, Desert Storm, I got so much support from the medical center, and it was just awesome. Just be able to get the letters, even from the chaplain services and administration.
What stands out to me about Loma Linda, it's the people.
It's always been the people.
They're human and caring and always want to help.
It's such a teamwork environment. It's collaborative.
You could not ask for a better team of coworkers.
There's a reason why I've been here, why I've stayed so long.
There is not a week that goes by that a patient doesn't tell me that they are amazed at how friendly everybody is. And that does make me feel proud.
I actually love to come to work. I enjoy what I do. I have such wonderful teammates. We always have a good time, always stay positive. I couldn't have a better crew.
I like working in the mental health community and helping people. It gives me a sense of purpose. They count on us to be there for them through their struggles and their journey.
To provide comfort through our words, through our touch, through our hands, and to uplift them, that they are acknowledged as a human being.
I'm a flight nurse with the Loma Linda NICU transport team, and I'm able to take care of even the 1-pound babies that are 400 grams. I'm honored to be able to see them take their very first breath, and many times that might be their last breath too. And so seeing the whole scope of a life and being part of that, I think is one thing I enjoy very, very much.
In the NICU, we choose a patient or a baby that we take care of every time we come to work. And the first one is the one that really stuck with me because he didn't make it. The mother and I cried together. We hugged each other. I went to the funeral. It was hard.
When you have a difficult day or you lose a patient, the leaders here don't just glaze over it. They actually take the time to come over and check on you. You can't measure that with anything else but just the generosity of their nurturing and their care and compassion.
I think that Loma Linda really values storytelling, and I really think that valuing storytelling means that you value humanity. You value the humanity of the person who's coming to you for help.
Dr. Hart had me go to Rwanda after the genocide. That trip has marked me in ways that are very deep. It made me understand the complexity of human condition and the need for being kind, regardless of where you go and how you go.
Loma Linda has become a place where I can help people. And I think that's the part that really gives fulfillment. And I think at the end of the day, I work in radiation medicine and it's a cancer diagnosis. I talk to our staff about sometimes having plan A, plan B, plan C. And what do we do when we're getting at plan C and we're still running into challenges? Sometimes we can't control what has happened, but we understand what we're looking at and where we can go from here.
One of the most touching experiences I've had with Loma Linda is when my father was here ill. The care that was provided was amazing. I think that was probably the most broken I've been. But I had one physician who actually reached out to me just to say, how are you doing? I know this is really hard for you and your family, but let me know if there's any questions you may have. So that speaks volumes about what this institution stands for. They go beyond just the patient.
When we say we're going to be somewhere, we're committed to it. If we say we're going to be there for you, we're going to be there for you, but it's not going to be a one and done thing. We're going to be with you, we're going to walk alongside you. We're here to help you get over the finish line.
More recently, when Dr. Hart put out the notes from the president, what he put down on there, what he believes about human beings and how we treat people, that one hit home because I'm an immigrant. I'm a child of an immigrant. And that hit home, knowing that I am part of this organization, because it is an organization that is striving to be beyond us. We're part of a bigger mission.
I am here because of Loma Linda, and it has supported me to do what I do every day.
I want to say thank you to Loma Linda.
Thank you for the years.
Thank you for supporting us.
Thank you for investing in me and my family.
Thank you. Thank you for being part of my family.